I am going to discuss on the topic disorders of the pituitary gland. The most frequent type of the pituitary disorders is the pituitary gland tumor. And the tumors are fairly common in the adults. They are not brain tumor and almost always benign. There are two types of tumor, functioning and the non-functioning. The functioning tumors that are produced too much of a hormone normally made by the pituitary, whereas the non-functioning tumors do not produce the hormone. And pituitary tumors are not the brain tumors and almost always the benign. And both types of the tumors can cause problems if they are large and interfere with normal function of the pituitary gland. And the problems caused by the pituitary tumors, they fall under three categories: hypersecretion, hormone deficiency, and the last one, tumor mass effects. The hypersecretions, where the pituitary hormones are too much, and that is caused by functioning of a pituitary tumor. The next category, hormone deficiency, that is too little of any pituitary hormone, and that can be caused by a large pituitary tumor, which interferes to produce hormones. And the last one, that is a tumor mass effects. As a pituitary tumor grows and presses against the pituitary gland or other areas in the brain, they may cause headache, vision problem, or other health effects. And if we see the pathophysiology, growth hormone, if the growth hormone deficiency occurs in the childhood, the symptoms, short stature, whereas the excess in the child condition, that is known as gigantism, in the adult, that is known as acromegaly. If prolactin deficiency occurs, then no disease states are still reported, whereas the excess secretion, that is known as hyperprolactinemia, it is also known as galacturia amenorrhea syndrome. Whereas thyrotropin deficiency in case of the child, that is known as cretinism, and in case of the adult, that is known as myxedema. And the excess secretion of the thyrotropin, that is known as thyrotoxicosis or Graves' disease. Whereas follicle stimulating hormone, that is folliotropin, the deficiency, that is known as a hypogonadism, and in that case, failure of the germ cells maturations occurs. Next category, leukotropion. The excess secretion, no information available, whereas the deficiency, that is also hypogonadism. Here, failure of sexual maturation occurs. The deficiency of the polytrophin, that's a failure of the germ cells, whereas the deficiency of the leukotropion, that is known as failure of the sexual maturation. The corticotropic hormone, that's the adrenocorticotropic hormone, the excess, no information available, whereas the deficiency, that is known as Addison's disease. And in that case, deficiency, that is another conditions, that's a Cushing disease or syndrome, and that is the excess, that is a hypercortisolism. In case of the oxytocin deficiency, no information available, especially that are necessary for the milk secretion, and the excess, no disease states are reported, whereas the vasopressin deficiency occurs, diabetes insipidus, that is excessive water loss and dehydration, and the excess secretion, that's a syndrome of inappropriate ADH secretion, that is hypertension. Now, I shall discuss the topic on the basis of cell types. What are the problem occurs by the dysfunction of the chromophil cell? Then chromophil cells again categorized, you know, that's acidophil cells and basophil cells, and what are the problem occurs due to dysfunction of the chromophil cells. So first one, you know that the chromophil cells are categorized in the two categories, acidophil cells and basophil cells. So first one, what are the dysfunction of the acidophil cells? In case of the hyperactivity, there's a condition, gigantism, that is found in the young and that are characterized by excessive growth hormone production, abnormally tall stature, excessive bone growth. Whereas in case of the acromegaly, that is found in the adult conditions, and that is characterized by excess growth hormone production, increase in bone thickness, coarse and facial features, enlarged hands and feet, carpal tunnel syndrome, headache, sweating, sleep apnea, fatigue, enlarged thymus, increased production of lactogenic hormone, hypertension, along with an increased risk of diabetes mellitus and colon cancer. Whereas the hypoactivity in the young condition that is found in the dwarfism, and adult condition that is acromegalia. The first one, dwarfism, that is categorized into three categories: Lorian-Levy type, Brescia type, and mixed type. The Lorian-Levy type, that is infantilism, stunted growth, sex organs and secondary sexual characters do not grow. The Brescia types, that is a fat body of the thickness, and the characteristic features also same: sex organs, secondary sexual characters do not grow, excess deposition of the fat in the body, a round chubby face, no beard, sleepy and slothful in nature. Whereas the mixed type, that is dyspituitarism, fatty and hairless, large accessory nasal sinuses, conspicuous supraorbital ridge. And the acromegalia, that is found in the adult condition, and that is a very rare condition, and characterized by growth hormone deficiency, bones of face, hands and feet are small, loss of hair and sexual character. Now, next category, the dysfunction of basophil cells. So first one, hyperactivity, that is a Cushing disease. And in adult conditions, the excess adrenocorticotropic hormone, too much ACTH, that stimulates the adrenal glands to produce excess amounts of the hormones cortisol, and obesity in the torso with thinner arms and legs, large rounded face, thin skin, that are the pink streaks on the abdomen, muscular weakness, osteoporosis, high blood sugar, high blood pressure. In male, excessive hair growth and atrophy of testes, whereas in female, masculinization with growth of breast, absence of menstruation. Women are affected four times more in comparison to men. And this is a hyperactivity, that's a adrenal insufficiency. So decrease in the production of the adrenocorticotropic hormone. Cortisol production is not stimulated. Symptoms are related to low levels of cortisone and aldosterone hormone that regulate metabolism and blood pressure along with other vital functions. And next category, dysfunction of the chromophobe cells. Froelich syndrome, that is found in the children condition, characterized by adipogenital dystrophy, stunted growth, stupid sexual infantilism, generalized obesity. Whereas the Lawrence-Moon-Riddle syndrome is occurring often in a family member, polydactylism, retinitis pigmentosa. And there are Froelich syndrome, that is found in the adult condition in male, adiposity of the feminine distribution. Appearance resembles of the female, degeneration of sex, hands and feet are small, pretty delicate and tapering finger, skin of fish, and body is smooth and hairless. In female, extreme adiposity and degeneration of the sex. Next, dysfunction of the pars distalis, hyperactivity that is not known as a pure clinical type, often appeared in a mixed form. Whereas the hypoactivity, progeria, that is found in the children, early senility. Whereas the Simon's disease, that is found in the adult conditions, and loss of weight and shrunken appearance, extreme weakness, lowered BMR, mental deterioration, atrophied viscera, hypoglycemia, anemia, sexual degeneration, degenerate gonads. And other pituitary disorders, such as hyperprolactinemia, that is caused by pituitary tumor and that secretes prolactin, or a tumor that prevents the regulation of the prolactin production. In female, production of breast milk outside of pregnancy and lack of monthly menstrual period, occurs. And whereas in male, decreased sex drives and erectile dysfunction occurs. These are the factors. Now, diabetes insipidus, that's a decreased production of the antidiuretic hormone by the hypothalamus, and kidneys do not conserve water and concentrate urine, and the person becomes thirsty and has frequent dilute urination. That is the characteristic feature of the diabetes insipidus. Then Nelson syndrome, that's a result when both adrenal glands are removed as part of treatment for Cushing disease. And that is a pituitary tumor that produces adrenocorticotropic hormone enlarges and can cause loss of other pituitary hormones, and that causes darkening of the skin due to increased production of the melanocyte stimulating hormone. And so many other disorders, so multiple endocrine neoplasia type 1, that is inherited genetic mutation that increases the risk of developing tumors in the pituitary and other endocrine glands. Kalman syndrome, that is also inherited condition that caused by the deficient release of gonadotrophin releasing hormone, and that leads to lack of follicle stimulating hormone and luteinizing hormone production, cause delayed or absent puberty. Then Sheehan syndrome, that's a very rare condition that is caused by severe bleeding during childbirth that can cause the pituitary gland to lose function. It is a specific kind of pituitary infection. Now, deficiency in oxytocin, there's a problem during labor and in nursing the infant because of insufficient milk ejection response. These are the reference books: Human Physiology, C.C. Chatterjee; Medical Physiology, A. Das; Essentials of Human Physiology, R. Suresh; Concise of Medical Physiology, S.K. Choudhury. And the figures are captured from Google image. Thank you, everybody.